raise your hand if you've personally been victimized by acne. Well, here's the lowdown from a board-certified dermatologist. Hi everyone, I'm Dr. Weinstein. I'm a board-certified dermatologist, and I'm here to answer all of your skincare questions. Today, we're gonna be talking about acne and why does it still haunt us into our 4th and 5th decade. Well, before we get started, make sure you like and subscribe to this video below. If you like this type of content, please drop that in the comments below, and I'm open to future suggestions on what you wanna hear about your skin. So let's get into it. Acne comes in all different shapes and sizes and can affect the very young to the very old. Yes, you heard me, it can affect the old. In fact, I've seen patients as old as 60 or 70, and let's be honest, that's not very old this day and age, but it can be very frustrated if you've made it to your prime and you're still experiencing issues with acne. One huge misconception is that acne is caused by dirty skin. So often patients will come in and they'll say, I don't understand why I'm getting acne. I wash my face twice a day, I never sleep in my makeup, and I wear my sunscreen, and so why am I still getting acne? Well, the dirty skin theory couldn't be farther from the truth. There are so many different causes of acne, including hormonal fluctuations, which can occur as early as our teens and continue into our adulthood. What happens with our hormones is that we start to produce an overload of androgens. The root cause of hormones and acne is androgen production. Androgens are hormones that lead to the overdevelopment of sebaceous glands or oil glands around our follicles. When we have more production of oil glands, we're more likely to get clogged pores and cysts, especially in hormonally prone areas like the chin and the jawline. So these are common areas and a common reason why acne presents itself by deep cysts that can sometimes be painful in what we call the beard distribution or that testosterone androgen distribution of a male. So typically hormonal acne will occur on the chin, around the neck, and on the sides of the face. If this sounds familiar and you're experiencing cyclical outbreaks of painful acne-like cysts in the chin and jawline, then you might need to check in with a board-certified dermatologist. Often over-the-counter medications and washes and products will help with your overall skin health and sebum production, which is oiliness, but it won't help that cyclical outbreak of acne in this area. We have sophisticated prescription creams that have anti-androgen ingredients to help with acne breakouts, as well as very safe oral medications like spironolactone to help with hormonal breakouts. So make sure you contact your board-certified dermatologist, or if you need help finding one near you, make sure you drop that in the comments below. Another common culprit for acne is actually what you eat. Now, you might have heard you are what you eat. That's not exactly true, but certainly the things that you ingest can affect the clarity of your skin. Now, I have a whole video dedicated to skin and what happens on your skin based on what you eat, and so make sure you check that out after you watch this video. So we know foods that are rich in refined carbohydrates, those that have high glycemic indices, those that are pro-inflammatory, can also cause inflammation on your skin and lead to acneiform type breakouts. Now, there's limited data on foods containing dairy and gluten and their direct relationship to acne breakouts, but we know that these foods can put your body in a pro-inflammatory state, and therefore anything that leads to inflammation on the skin can cause an acne breakout. There are even different kinds of vitamins that have been known to cause acne breakouts, like vitamin B12 and biotin. So if you're having a problem with consistent acne breakouts, make sure that you avoid these over-the-counter vitamins. Another surprising thing that can contribute to acne breakouts is skincare. That's right. If your skincare routine is not customized to your specific skin type, then you could be using products that lead to acne breakouts. If you are prone to acne breakouts, you want to make sure that you're buying products that are non-comedogenic, which means they don't clog pores, and also those products that are oil-free. So often there will be oil-based products that say they help to calm and soothe the skin, and that might be true. And because your skin is inflamed and you might have pimples and cysts on the face, these products might feel good on the skin, but in fact they could be clogging pores and potentiating more acne breakouts. Over-drying acne-prone skin can also lead to more acne. So products containing salicylic acids, benzoyl peroxides, azelaic acid, these are all great for acne-prone skin, but if you overuse and don't replenish the skin barrier with moisturizer that's oil-free and non-comedogenic, you could also be stimulating more clogged pores pores and more breakouts. And let me go back on one thing I just said. So if you have acne-prone skin and you feel like you're super oily, that doesn't mean that you don't need to moisturize. Moisturizing is key to repairing and soothing acne-prone skin. Many of the ingredients that we prescribe as dermatologists or that you find over the counter are drying, as I mentioned. Salicylic acid and benzoyl peroxide can be very drying, and so it's very important to moisturize the skin after applying these products. So what does a skincare routine look like that's appropriate for acne-prone skin? First of all, you need to simplify your skincare routine. You certainly don't need 30 different steps in your skincare routine. Start with a gentle cleanser, a moisturizer, and a sunscreen. All of these products should be oil-free and non-comedogenic. Some great examples of a gentle cleanser include those by CeraVe, Cetaphil, or Neutrogena. If you feel like using a gentle, creamy cleanser is not cleansing your skin appropriately, then you can opt for a foaming cleanser, which would be more appropriate for more oily skin. Once your routine is simplified, including the steps I mentioned, then you can start gradually adding in more ingredients to help with different aspects of your skin. One great option to add into your nighttime skin routine would be a retinol or a retinoid. If you have acne-prone skin, then we definitely need to find ingredients that help stimulate cell turnover, like retinols, which are over the counter, or retinoids, which are typically prescription. Start by incorporating them into your skincare routine 2 to 3 times a week, and then gradually increase as your skin tolerates it. One great example of an over-the-counter retinoid is actually Differin, which is adapalene gel. Adapalene gel used to be a prescription, but it's now available over the counter. So if you want something gentle but effective, I would start with adapalene gel and use it 2 or 3 times a week at bedtime after cleansing, and then gradually increase as your skin tolerates. As I mentioned, retinoids help with cell turnover and help break down the buildup of dead skin, which can contribute to more acne. Hyaluronic acid is a great ingredient as well to incorporate into your skincare routine. Incorporating hyaluronic acid into your morning routine can help deeply hydrate the skin and replenish your skin barrier, especially after using potentially drying ingredients. And don't forget to moisturize. As I mentioned earlier, dry skin can make acne much worse. When your skin is hydrated, your oil glands can secrete oil properly. So if it's over dry, you're going to produce more oil in order to compensate for that dry skin state. If your skin is too dry, that oil will get trapped underneath a stack of dead skin cells, leading to clogged pores. Speaking of pores, pores are something we get asked about all the time as board-certified dermatologists, but it's important to note that everybody's pores are 100% normal. It's part of normal anatomy. Now, don't get me wrong, pores can expand and shrink and look bigger and smaller based on different things, but it's important to remember that everybody has pores. There's really no need to fixate on them or try to get rid of them completely. Some tips to help reduce the appearance of pores are exactly what we mentioned. So use ingredients like salicylic acid, which actually helps to dissolve sebum, so it'll penetrate into the pore on the skin, especially in the nose and this mid-cheek area, and dissolve that oil so that the pores can shrink back down naturally. And another thing to do is use retinoids, like I mentioned. Differin will help to promote cell turnover and exfoliate that top layer of skin so that the pores can regenerate and shrink in size as well. A huge no-no is to get in the mirror and start picking out all of the blackheads in your pores, especially on your nose. What happens when you do this is you can actually lead to the development of enlarged pores and scarring. And so if you have a habit of picking at your pores or trying to extrude some of that oil in the pores, I would do your best to try not to pick and to use ingredients like salicylic acid. You can find it in a toner or a gel to apply there instead. Often I'll have patients come into the office complaining of pores that seem to be permanently enlarged, and I ask how often do they pick and try to get rid of all the oil, and it's a daily habit. And so when you do this, it causes this persistent level of inflammation, and your skin sort of thickens around that pore to try to protect itself from you. So it's worthwhile not picking, just use the right ingredients and seek help from your board-certified dermatologist if you're frustrated. Board-certified dermatologists like myself can help you establish and simplify your skincare routine, especially if you're acne prone. We can also offer you treatments that will help reduce your pore size, clear out those clogged pores, treat active acne, and even treat some scarring that might come after some acne flares. If you have more questions about different treatments for acne scarring, check out my video on treatments for acne, and where I talk about all the different devices you can use to help treat acne scarring and to get your glow back. If you like this content and you're looking for more, please drop your questions in the comments below, and make sure you like and subscribe. A new video drops every Sunday. See you then.